Well, do you suffer from sore knees, stiff joints or aching hips? Plenty of people do. In fact, 1 in 7 Australians suffer from arthritis, with up to 18 million global formally diagnosed with rheumatoid arthritis. The chronic disease causes inflammation in the body and triggers pain in the joints and can lead to heart, lung and nervous system problems, costing the health system billions.
And while there is no cure, researchers have found that a drug already used to treat rheumatoid arthritis could also prevent the disease for those at risk. For more, we're joined by Medical Director of Arthritis Australia, Dr. David Liew in Melbourne. Good morning, David. Thanks for your time.
Good morning. Great to be here.
Before we talk about this drug and this trial, can you just tell us, our viewers, how does rheumatoid arthritis, manifest? What does it do to the body?
Absolutely. It causes pain, swelling and stiffness in joints, especially in the hands and the feet. It's a chronic inflammatory condition. So it keeps on going. It's the body's defence system, its immune system, attacking itself persistently, causing inflammation primarily in the joints, leading to that pain, swelling and stiffness, but also in all other parts of the body. So throughout muscles, soft tissue, and it can affect other things like heart, lungs, and also lead to things like brain fog.
Yeah, wow. So can you tell me a little bit about this drug that was trialled? We know that it's already used to treat rheumatoid arthritis, but this clinical trial has found that it might prevent those from getting it or developing it if you catch it early.
Yes, it does. So abatacept, Orencia, is a medicine which puts some brakes on part of that inflammatory response that the immune system has. It creates rheumatoid arthritis. So certain antibodies can trigger inflammation. And abatacept, which is a weekly injection under the skin, helps to put brakes on that. Now, we currently use that for rheumatoid arthritis, and it's quite effective in that setting. But there was a lot of thought that maybe if we put this in early enough, as rheumatoid arthritis was starting to build up, then maybe we could stop rheumatoid arthritis from developing altogether. That's exactly what this study in the UK and the Netherlands looked at. So 213 people in those countries were looked at whether if they got abatacept versus getting placebo, whether they could actually put off the risk of developing rheumatoid arthritis. The catch here, of course, is that it's looking at people at a specifically high risk of developing rheumatoid arthritis.
Yeah, how do you recognise those people? Who is at high risk?
Well, those antibodies that I talked about that might trigger off the inflammatory process. If you look for people with those antibodies, perhaps those people might be at greater risk, especially if they've got joint pains and muscle pains. And so those are the patients who were looked at in the trial.
So just how promising is this trial when it comes to managing chronic pain, which we know impacts on people's livelihoods and their lives and also has a dramatic impact on the health budget?
Well, I mean, this isn't going to be for everyone, but the idea that we might be able to stop people from having to deal with a chronic disease in the first place is incredibly enticing. If we can try and stop people from getting down a cascade of rheumatoid arthritis where they get stuck with daily pain, stiffness and swelling, that'll be a real win. Yeah.
Now, I know that this was a UK trial. What's going on here in Australia with respect to trials? I believe there's some work going on with immunotherapy.
Absolutely, and I think the exciting bit about this study is that actually we're going beyond trying to manage this as a chronic condition and deal with the symptoms and pain as they come up, and actually go to something where we're getting people out of that. This is a prevention study. What we're doing in Australia as well is working on things even more expansive than that, a cure. And in fact, what the primary investigator in the study that we saw from the UK and the Netherlands is doing is working with Australian investigators on really exciting Australian technology, which looks at potentially delivering a cure for rheumatoid arthritis for some of them. Professor Ranjeni Thomas at the University of Queensland has been spearheading a team which is actually bringing some technology which hopefully will come to market in the next couple of years.
OK, well, me and my dodgy knees are going to keep a lookout for that. Thank you so much, Dr. David Liew.
Thank you so much.